Welcome everyone to the Canadian Public Health Association's Infectious Disease and Climate Change webinar series. This series explores current and emerging infectious disease and climate change topics to share knowledge, research, and best practices with you all. Before we begin, I want to acknowledge that the Canadian Public Health Association's office is situated on the ancestral and unceded territory of the Algonquin and Anishinaabe people. They've been the guardians of this land for millennia, and we are grateful for the example their stewardship provides. CPHA is committed to working with all First Nations, Inuit, and Métis people and their governments in realizing meaningful truth and reconciliation. Today's webinar, From Prey to Hunter, Training Mosquito and Tick-Borne Disease Education Ambassadors to Meet Outreach and Surveillance Challenges in Canada, is brought to you by the Canadian Public Health Association through the Infectious Disease and Climate Change Project. I'm Jillian Pritchard, my pronouns are she, her, and I'm a project officer with CPHA, and I'll be the moderator for today's webinar. Before we begin, I want to take a quick minute to let you all know about some other infectious disease and climate change projects that we have undertaken at CPHA recently. You can find more information about them all on our website at cpha.ca. Firstly, we recently launched a new resource package on our website, which is a compilation of the most recent research, reports, tools, and other evidence-based information regarding infectious disease and climate change in Canada. And also, we've recently released a new report on infectious disease and climate change in Canada, which summarizes conversations with 16 key informants describing what is currently happening in Canada with respect to climate change and infectious disease. It also highlights challenges and opportunities within this emerging field of inquiry. And I'll also send a link to these both in the follow-up email to today's webinar. We're all pretty familiar with Zoom and webinars by now, but just a little bit of housekeeping. It should be noted that everyone on the webinar is muted. And if you have any questions for the presenters, please type them into the Q&A box at any point during the webinar. If after the presentation, I will read the questions out one by one and have our presenter answer them. If you have any questions regarding technical difficulties, please also put them in the Q&A box and I'll answer them individually if it's like a one-on-one problem, but if multiple people are experiencing the same problem, I will address it live. And we really strongly encourage participation and we really look forward to hearing your thoughts and questions today. A few quick notes that this webinar is being recorded today and it will be made available on the CPHA's YouTube channel a few days after the end of the presentation. And the presentation slides will also be shared in a follow-up email. And we'd really love to get your feedback. So please fill out a 5-minute survey at the end of the webinar. Upon closing the webinar window, it will open in your internet browser. It's really valuable for us to get this feedback. Now I'd like to introduce our speaker for today's webinar. Karl Forest-Bérard is the scientific advisor at Quebec's National Institute of Public Health. He's an enthusiastic entomologist and science communicator. Before joining INSPQ in 2016, he obtained a master's degree in clinical pharmacology from the Université de Montréal. His recent work has focused on zoonotic disease, particularly vector-borne diseases transmitted by ticks and mosquitoes in Quebec. Over the past few years, Karl has been involved in field monitoring of invasive mosquito species at the Canada-US border, developing outreach content on ticks on different platforms, and leading citizen science projects to explore new avenues for surveillance of zoonoses in the province. With that, I'll turn it over to you, Karl.
Yes. Thank you. Hi, everyone. Thank you, Jillian, for the introduction, and thank you for having me here today. Happy to be here. I'll share my screen. This should be working.
Perfect.
Awesome. So before I begin, I want to mention that I do not have any competing interests to declare. Maybe also introduce a little bit INSPQ, saying that it's a provincial organization and a center of expertise and reference in terms of public health. INSPQ works in support of Quebec's Ministry of Health and Social Services, and its main mission is to develop new knowledge, strategies, and intersectoral actions likely to improve the health and well-being of populations. Also, before we begin, I want to apologize as some of my slides or content might be in French. If anything is unclear, I will be happy to translate or clarify. I will also like to mention that we are having a similar webinar on the same topic in French tomorrow, Wednesday, 13th at noon Eastern Time. The link will be provided in the follow-up email. So if any one of you would rather listen to this presentation in French, you're welcome to join tomorrow. Oh, there we go. Also, before we start, I would like, in my personal name, to acknowledge that our work in Tiohtià:ke or Montreal takes place on the unceded indigenous lands of the Kanien'kehá:ka Mohawk Nation. Tiohtià:ke is known as a gathering place for many First Nations, and then I would like to recognize them as custodians of the lands and waters on which I stand here today to present the webinar. And last but not least, I am here presenting this project, a project I have been working on for the past years, but I was obviously not alone. There is a multidisciplinary team behind me, and I would like to acknowledge their work and thank them for their contributions. You might recognize some of them. In terms of plan of the presentation, it's pretty standard and straightforward. The project I will be presenting here today has two sides, one first on ticks and the following one on mosquitoes. And I'll be presenting the tick one as an example first, and then moving on to the mosquito side of it. So for those of you interested in mosquito related information, please bear with me. We'll get to it in a second part of the presentation. Well, this project was also more or less of a test drive to explore citizen science approach in public health projects. So the data that I will be presenting today is not, it's not massive, so don't expect any heavy statistical analysis here, but it will also resonate with what other presenters have exposed here in this web series in the past weeks or months. So yes, moving on to this context. Again, because I know a lot of the audience is very well aware of Lyme disease or vector-borne diseases and mosquito-borne diseases, I don't have to set the stage for this. Anybody that's been looking at the news knows that Lyme disease is on the rise in Canada, but just to set the table for, or at least give a proper context to this project, we know that ticks have been on the rise in Canada and Quebec for the past decades, that climate change has been pointed out as one of the main factors, shifting climate patterns or ecological changes, eroding land use, changes in human activities, all making it easier for them to establish and develop on our territory. We know that Lyme disease is transmitted by ticks, and that it can be a very disabling disease if it's not treated and diagnosed swiftly after the tick bite. In Quebec, Lyme disease is now the most commonly reported vector-borne disease in Canada, but Quebec is among the Canadian provinces where the most Lyme disease cases are declared annually, going from a few cases in 2008-ish to a spike in 2019 prior to the pandemic. That's provincial-wise and Canada-wide, sorry. And then we know that it can be treated with antibiotics if it's diagnosed rapidly, but we also know that there's no vaccines for humans at the moment. So all the more reasons to be giving more attention and more energy into prevention and disseminating the information for different vulnerable populations. We know that outside workers and other subpopulations are more at risk of developing Lyme disease or tick-borne diseases because of their higher exposure to tick habitat. So that's why we have to put in place different tactics to protect the population and kind of keep track of what's going on. In terms of prevention tools to address this emerging issue, public health authorities in the province and in Canada are leading different types of campaigns to raise awareness of the public and conducting also surveillance activities to keep track of the evolving risk areas in the country. In terms of awareness raising campaigns, it mostly consists of disseminating the information on preventive measures that can be done on websites or media advertisement, pamphlets, flyers, posters, and that can be addressing different sublet of the populations. We've developed a few years ago a e-learning designed specifically for workers and employers that can be seen freely on the INSPQ website. I remember also PHAC having like this little transportable museum thing that can be booked and placed in different places. Anyway, not going to go into the entire detail of the array of outreach options, but due to the limited available resources, these campaigns are usually targeting very general population and not necessarily accessible locally. And so there's still a room for improvement on this level. Also, like I mentioned, we public health have also the responsibility of keeping track of the evolution of the disease and the ticks on its territory. So to do that, we have in Quebec the Integrated Lyme Disease Surveillance Program. Not going to go into the entire details of this. Just going to say that it's combining human, animal, and tick data to create a provincial Lyme disease risk map that guides the decision makers and help clinicians with the diagnosis and treatment of patients. So yeah, it gives a better understanding of the situation. This is the map as of this year. It's constantly in evolution. However, to generate this integrated data map, it's very resource intensive, requiring the involvement of several partners and trained workforce available during the tick season. So mostly financial constraints and the sheer size of Quebec also make active surveillance a little bit challenging to implement. So as I was saying, there's obviously room for improvement. Combining all of these is important to get a proper portrait of the situation, especially since they each have strengths and limits, pros and cons. Alternative methods to further improve the geographic coverage and efficiency of the archaeological surveillance are always sought. So this brings the questions: are there any alternatives or improvement that could be making the surveillance program a little bit more efficient or more a little cheaper or easier? As I was mentioning, there's a lot of subpopulations that are more vulnerable. So we asked ourselves the question, would it be possible to feed two birds with one seed and try to get people that are more vulnerable and in need of outreach and information about tick disease, but are also already in the field for their regular occupational activities? So we were curious to see if there were not a possibility to train them to allow and try to, well, yeah, feed two birds with one seed. Among those pictured here, you can see mostly outdoor workers, going from park workers or rangers, patrollers, forestry workers, wildlife officers, day camp or school camp employees, land surveyors, municipal and highway workers, military personnel, and the list goes on. And there enters citizen science, which is everywhere nowadays, as most of you probably know. It's been growing in popularity. It's in a few words, citizen science can be described as any form of scientific knowledge production or project in which a professional scientist and an amateur scientist or citizen will participate in an active and concerted way towards a similar goal, and where the citizen can be involved at any level of the project, from the field collection to the analysis. And this can be applied to a wide array of fields, from astrophysics to climate change monitoring, or keeping track of invasive species or endangered species, for instance. I am giving a few examples here on the screen without going into too much details, focusing on vector-borne initiatives. The first one, the Germany one, is a big application tracking mosquitoes and providing maps of the entire country to see how where we have vectors circulating, local ones and invasive ones. On the bottom one, the example number 2, e-tick, I remember Dr. Jade Savage presented the initiative a few months ago, also a very good and a Canadian initiative that also relies on citizen science of passive detection of ticks. So yeah, so simply put, we wanted to address some of the challenges associated with Lyme disease outreach and surveillance in Quebec by exploring an adapted version of the training of trainers teaching methodology, which is also dependent on citizen science. And this approach relies on the idea that every student can become a teacher if given the proper tools and time. So that a single public health professional or institution may convert less experienced individuals into new trainers who can subsequently pass on the knowledge to others in their direct vicinity, either professionally or personally. And there are multiple training of trainers, or TOT method, success story that have been recently documented in health intervention literature. So we wanted to, with this project, our goal for with this project was really to evaluate the feasibility and implementation of this methodology to raise awareness about Lyme disease and prevention amongst different outdoor workers in Quebec, but at the same time, seeing if it has a potential to contribute to the surveillance efforts. So that sets the stage for the project. In terms of methodology, I think it's pretty straightforward. This slide is in French. I'll try to do my best to translate as I go. So yeah, to put this idea to the test, we selected and trained workers and park administrators from various publicly accessible natural park and conservation organizations to become what we called Lyme disease ambassadors or Lyme education instructors. And they were in charge of raising tick awareness, sharing the information about Lyme disease and preventive measures, but as well as leading tick sampling activities during flannel dragging, the gold standard approach we use in public health for tick collections in their respective communities. So to find participants, we partnered with Natural Conservancy of Canada, NCC, which is a nonprofit organization whose main focus is conservation, obviously, of natural areas. They have a wide network of, well, obviously workers, but they also have a variety of properties at national level that can be sampled for ticks. So the concept of the project was to develop a training for trainers that were the targeted ambassadors, training them both on the knowledge of it and the practical side of protocols and tick dragging, and then inviting them during the course of the summer or the tick activity period to lead at least 2 activities of each type, meaning 2 outreach activities or more, and 2 tick dragging activities or more during the activity period. So basically that was the entire concept of the project. Without going into much details here, you can see that we were giving the workshops in May, that was in 2019. The workshops giving in person in 3 different locations, 3 different regions in southern Quebec. And then we had them evaluate the training, and then in red from June to October, they were invited to lead their different activities. They were giving all the information in a starting kit, and then they were free to adapt it depending on their availabilities or their personal interests during that time period. We kept monthly checkups on them, and we also were available for support at a distance. And at the end of the project, we collected all the samples, had another evaluation of the project, and obviously analyzed the data that we received. So here again, pretty straightforward. This is the Turnkey Starting Kit that was provided at the workshop to each of the participants. So you have here both the necessary information for outreach activities and for the dragging activities. Some of them on the bottom right of the screen were to be returned, obviously the samples. They had a Tyvek combination, and the flannels were already prepared for them for standardization reason, but we also explained them step by step how to have a DIY flannel if needed, or if they wanted to lead their own activities or have more people participate. This content of the training itself was elaborated using obviously the public health recommendations issued by both federal and provincial instances. It was supplemented by online material, existing literature, etc. It was adapted for a public with various levels of literacy, favoring a graphic-rich and jargon-free design so that it's friendlier and easier to assimilate. And it was obviously also, all of this information was validated with our team of our cross-disciplinary committee, which is composed of different types of physicians and academics, biologists, communication counselor, etc. So the way we proceeded during these workshops, we had a 90-minute information session where we talked about everything and anything about ticks, Lyme disease, clinical presentation, preventive measures, tick biology, tick removal, and then introduction to tick sampling methodology. And then we had a 90-minute test drive of people trying their first tick dragging in the vicinity of where the workshop was being held. I'm not going to go into details about how we do the entire protocol. It was a simplified version of the one that is usually used for the regular activities of surveillance in Quebec. We made it a little bit simpler to protect or to avoid unnecessary exposure of the ambassadors during their activities, but otherwise it's basically the same. So you drag the piece of cloth, the piece of flannel in the forest floor, and you check on it every 25 meters and documenting and collecting any ticks that you get. I put here a little bit more pictures so you have a better idea if you've never seen or done tick dragging in the past. This is one of our colleagues, Catherine. So yes, moving on. So we had two types of samples collected, the ones that were the ticks that could have been collected during the supervised sampling, after or during the workshops, and then any other autonomous samplings that the ambassadors would have led on their free time during the summer. And then whatever is collected at that moment will be kept in alcohol in their freezer, and then would be sent at the end of the activity period in late September or early October for us to identify the species and then screen the ticks for pathogens. In terms of results, I'm going to give you a little bit more pictures of what it looked like. So we have here ambassadors having their first trial of flannel dragging and pictures of ticks and activities that were organized, just as a visual. Also here you can see one of the fields where tick dragging was organized by ambassadors. That's one of the field that was place that is owned by Conservancy Canada. You can see a picture that was taken at the beginning and at the end of the sampling so that you can document and verify that the conditions and the habitat and the the weather was all in check, making sure that it was performed in the correct environment. And then in terms of spatial distribution of the entire activities that were led, we've had activities in 7 different public health units. So it's extending beyond the ones where the workshops were initially organized, which are shown here in yellow. And then the activities in orange. And these are the, I'm sorry, so these orange ones are the outreach activities that were organized in different regions. So it's spanning roughly 500 kilometers from east to west. And it's interesting because this territory covered represents only but a fraction of the entire province, but it encompasses the most populous urban centers and the main endemic areas for Lyme disease. And in terms of outreach activities, because we gave them kind of a free, they were free to use the material and the ideas and the tools that were given to them. So we had a wide, a lot of different types of activities, going from completely independent and self-porting activities where it was organized specifically for this project, or other activities that would be combined with their regular activities, the ambassadors as occupational the regular programmation of their title, and then adding the outreach about tick and Lyme disease to it. Those could be also physical in-person activities, either indoor or outdoor, and also virtual activities that we later became very familiar with. So we have a very wide type, a lot of different activities that were organized, from, let's say, lunch break conversations about it, or nighttime conferences with public, or disseminating the information through their emails, or their summer camps, or having the information really available at little stands that it will be there in their office space, or their outdoor patrollers would be handing out the information, for instance, etc., etc. In terms of outreach activities here overlaid in purple, it was also in the similar areas, necessarily because the ambassadors were the same, leading both activities. If I overlay them, that gives you the entire portrait of it. And then in terms of overall results, the raw numbers of it all, so we had, like I mentioned, 7 different public health units from May to October, 3 workshops in 3 regions, 18 ambassadors were trained, of which 16 were very active during the project. We had 28 outreach activities reaching directly at least 1,800 person. That is probably a number that is probably underestimated because it includes and it excludes individuals reached through open activities like an information stand or a newsletter or a public interview, let's say. So in addition to that, so that's why this number is probably underestimated. And in addition to that, these results do not take into consideration the repercussions in the future that the network might have, as the ambassadors can keep disseminating this information in the future. Another interesting fact about this is that about 10% were employees or employers of these ambassadors. So in terms of occupational safety, it's interesting because these are not necessarily workers. There are vulnerable workers that would not have been prioritized according to the actual program in occupational health in Quebec. So those benefited from an enhanced prevention and outreach and sharing of information, sorry. In terms of samplings, we had 28 sampling activities, so a total of 56 kilometers covered. 36 were collected. All of them proved to be Ixodes capillaris, the black-legged tick that transmit Lyme disease. Some of them were positive for Borrelia burgdorferi, the bacterium causing the disease. We had no other pathogens detected. The overall yield of the ticks collected here, 36 ticks, can seem, it can appear a bit low and insignificant, but taking into account the context of Lyme disease actual epidemiology in Quebec, and based on the regional risk assessment criterions that we have in place, you have to take into account that every collected tick has the potential to change the Lyme disease risk level on the map I showed earlier. So every tick really counts. And as a matter of fact, of all the ticks that were collected in this little project, most of them were already in areas where the presence of ticks or infected ticks was already documented, but on 2 instances, we had new information coming in from the ambassadors. And in one of these instances, it did, when merged with the database from the regular program of surveillance, did contribute to change the risk of one municipality. So that also is an interesting thing to notice about this. And then in terms of evaluation with the ambassadors and their overall feedback, it was also very positive. We've had people wanting to participate again in the following years. Yeah, I think that's all I had to say about this one. Now, for those of you who are interested about mosquitoes, what we did, or what we were supposed to do in 2020, is to take the same recipe, the ambassador training of trainer approach, but bring it with a different flavor, with a mosquito flavor, so I think this is going to be similar in some points to what Dr. Sarkar presented last month in the same webinar series, where they use also citizen science to go collect mosquitoes. Only this time it's not specifically or exclusively looking for invasive species. It's really just to go and sample whatever mosquito is in the direct environment. But otherwise, the recipe is the same. And the idea behind it, the context is the same. So we know that mosquitoes are also affected by climate change, and the projections of different studies show that the vectors for West Nile virus in this case is projected to be reaching northern territories as time goes by. We know that, I just mentioned West Nile, but we know that other arboviruses are also circulating and already present on our territory, with a bunch of different vectors, mosquito species that are potential vectors of these disease. In terms of the California serogroup, we know that snowshoe hare and Jamestown Canyon are present in the country. In terms of West Nile virus, or VNO in French, we know that we have spikes from year to year. It's much more fluctuating, seasonally speaking, than Lyme disease or tick-borne diseases. But we have had deceased, several hundred cases, some of them leading to death. So it is kind of concerning, and it is projected to keep getting worse with time. The difference with this project, other than the subject itself, going from ticks to mosquitoes, is that because of COVID, we needed to adapt the project to make it feasible. So we took this opportunity to make it into something that could be done remotely, obviously. And so all of the workshops were done remotely. And then instead of using what we usually do for mosquito surveillance, which are, well, professionally designed traps like the one on the pictures on the screen, we decided to go with DIY, so any kind of traps that can be constructed by ambassadors themselves without needing to buy material or professional structures to capture mosquitoes. And we gave them a little budget to do so that they could equip themselves to protect themselves, but also build the traps for their projects. and the rest of the project, I'm not mentioning it here, but the recipe is the same. So we did the same training developed on whatever public health recommendations we had. And so the outreach part was very similar to what we did with ticks, only for mosquitoes, focusing on the ones that we have circulating here in Quebec and in Canada, with a little parenthesis about invasive mosquito species, as we know that, for instance, in southern Ontario, new species like Aedes albopictus have been recently detected and now believed to be established in the southern tip of Ontario. So we had a little parenthesis about invasive species as well. And then it's because there's different types, a lot of different species of mosquitoes, and that the life cycle is different. We have different trapping approaches targeting different parts of the cycle. And we also introduced in this project, compared to the other one, a difference between passive and active surveillance approach. So we used traps where the ambassadors could go and actively seek the mosquitoes in nature, but also collecting them passively, for instance, in their vehicles or by the side of the windows out inside, or whenever they're minding their own business at home or outdoors, and they, instead of being bitten by the mosquito, they would find any way to catch it and put it in the freezer and then bring it into our sampling. But we also had traps designed for eggs and larvae, the other juvenile stages. I'm not going to go into details about all of the different protocols and traps that we proposed and suggested to the ambassadors. Here's just a few in pictures to give you a little idea. We had the net version. We had the pooter that was presented last month as well, which proved to be very, very popular amongst ambassadors, because they could just carry it with them and walk around, do their regular activities and suck on any mosquito and bring it home with them without damaging the sample, but also protect themselves. In terms of larvae, it's a bit trickier, but we also had people collecting larvae and the eggs, which is incredibly small, but also possible to collect in the environment. Just a bunch of other images to show the DIY aspect of it. This is borrowed by something I borrowed from the British Arachnological Society, going step by step to build your own little pooter. Same for the algae traps, which is just crazy simple to build. We had different versions for in a cup, or using a stick or paper as the substrate for the eggs to be laid on, or a version with a wet sock with stained water. Again, we provided all of these informations to the ambassadors, knowing that it's also a good prevention strategy. It's part of the tools of prevention, and leaving them a complete. They were free to use whichever technique they preferred, or the one they find the most adequate for their regular activities. Again, in terms of raw preliminary results, we trained up. It's fairly similar. We trained about 15 ambassadors in 8 different public health units. They organized 37 outreach activities, reaching approximately 1,400 persons directly. Again, probably underestimated, because we're only taking only the recorded person that were directly contacted by an ambassador are registered here. 35 sampling activities of different types, catching about 150 specimens, of which, where there's a typo there, it's about 100 adult and 50 larvae, and about 200 eggs collected. All of this is still pending lab analysis and species identification. The other things that we added on this project, trying to improve from the tick one, was that we also added a knowledge evaluation. So making sure, trying to keep track of what the ambassadors knew prior prior to the first workshop, and then assessing the same, asking them to answer the same question at the end of the activity period to know if they retained and remembered whatever was taught, and if they had improved and learned something through the project. We also proved, obviously, that it was virtually friendly as a project. It can be adapted to be done remotely. And it was also interesting as a result. I find that I was expecting to have a lot of bycatch in the specimens collected, but if it's explained properly, then the results are pretty clean. Just a slide to explain that there are a lot of other flying insects that are commonly identified as mosquitoes, and I was afraid at the beginning of the project that they would that we would find a lot of these in our samples, but it turned out, if it's properly explained, all we got in the submissions were all actually mosquitoes. So in terms of conclusion about this little project that I just presented, going back to the strengths and limits, we can see that the ambassador or teacher of the training of trainers approach also has strengths and limits. I think this project also demonstrates that it's a proof of concept, showing that ambassadors and outdoor workers have the interest and are capable of leading on their own outreach and sampling activities in their respective work environment or in their personal time. After being trained for half a day workshop, it did really answered, like there was a need from these ambassadors. They were really eager to learn about these diseases. And also, well, the data that can be generated through that can be of use in terms of surveillance. So it's not necessarily as an alternative to the integrated surveillance of it, but it has to be seen and perceived more as an asset or a complement to it, because they have strengths and limits, and I think they complement well each other. Obviously, we also created a new partnership with NCC, which proved to be a winning combination because of the quality and the reach of its network Canada-wide, really. So it was really a facilitating factor to be partnering with them. We also proved that well, at first I thought COVID would be a problem, but it worked well because people were already well equipped and well adjusted to the new reality. And the things that we lacked were, like, in order to properly consider this a cascade training, then the training developed lacks two main elements, I would say. One of them would be the knowledge evaluation that we implemented in the mosquito part, just to make sure that it's more like a quality control aspect to it, to see if the teaching quality and the knowledge retention and the changes in behavior are there. And then the other thing that's lacking is the sustainability of this network, ensuring long-lasting results with additional rounds of training ahead. So we have a proof of concept here, but to make it bigger and having long-lasting waves, so that we can build a proper network, a proper cascade training, we need perennial and recurring funding to make it have a long-term vision to it. In terms of, at the end of the project in 2019, we were in discussions with Canada Parks to see if it could be implemented on in their network, but then came the pandemic, so it stayed there for the moment. So to sum it up, I think it is indeed possible to feed two birds with one seed, taking care of both outreach and surveillance with community science, citizen science or community science. And that this approach has the potential to be, as I mentioned, not an alternative to vector-borne disease surveillance, but it is a nice addition to it and complementing the data that we gather for public health. And pushing this further, could include more types of worker or jurisdictions, and going broader and going bigger than just in the province. And it definitely deserves to be taken into account when designing a surveillance or a research project in the future. Yeah, so that's basically what I had to present today about this little project. I'm hoping you liked it, and I'm open for any of your questions.
It's great. Thank you so much, Karl. That was such an interesting presentation. It really shows the value that citizen science can add to our work, and yeah, what building those relationships can really do to create reach beyond what we can do from our offices. It's very interesting. I'd like to remind all of our participants now that this is a time we've got for questions and answers. So if you have any questions for our presenter, please put them into the Q&A box below at the bottom of your screen, and we can then read them out to our presenter. I'd love to get us started off. Can you tell us more about maybe some of the qualitative feedback we were getting from the ambassadors? What do they feel they're getting from it? Because we know we get so much in terms of data, but what value do they see in participating?
It's a very good question. Actually, I remember in 2019 when we first started the project, I was not super convinced about the idea. I'm not sure how people would receive and if they would get on board with it. And it turns out, again, the choice of the ambassadors was really important. And that's why the partnership with NCC was very appropriate, because we had a lot of experimented outdoor workers that already knew a lot about the preventive measures, but also they were the ones in contact with the public, right? So they had, it's really the first contact that most public, like visitors of a park or anyone having outdoor activities, they would be in contact with them first. And they felt most of the time that they would not have the proper information, or it was not as easy to transmit the information. So qualitatively speaking, everybody was really thrilled to participate. We had a ton of questions. You could tell that they were really into it, and it was something, especially for the ticks. It was very something people would worry about, and they would not feel prepared. So I think the main thing that came out is that people would say that they felt better prepared after following after being part of this project. Because ticks, I think a lot of people also would hear about ticks and Lyme disease and other diseases and never have seen one themselves. And so the fact of having tick samples to show them during the workshop, but then going into the field and collecting ticks and showing them and witnessing it themselves, that in terms of prevention was also very a big plus. And I think they like that. For the mosquitoes, because it was at a distance, it was more complicated, or not as first-hand contact, and so they could not witness it. But also it's interesting because most people will not take mosquito bites as a danger. So it was interesting to I don't want to say a wake-up call, but like it was interesting for them to open that box and see, okay, well, I'm getting bitten all the time, but maybe it is an issue. Yeah, so I'm not sure I'm answering your question, but
no, absolutely. No, it's interesting to learn more about that process. In terms of having people involved in surveillance and outreach, did you find that was good to pair those two, or do you think there's certain people that are better at the outreach part and certain people that are better at surveillance, or just want to do one or the other? Or do you think that for other projects moving forward that it really makes sense to pair these two?
Okay, also good question. I know for a fact that some people would not be, some of the ambassadors that receive all of the information, but then they relate it to a team, like let's say their own direct team, and they would then split the work. So some of them would be more interested in doing outreach or more qualified or more experienced to do so, and others that would be already leading other activities in the field, in the forest, and then would just join the protocol of tick dragging to it and make it work. So yeah, I think there's no right or wrong here. I find, like I just mentioned, like witnessing the ticks in the field yourself, I saw how much people were learning and curious and making them very well aware that this little path that you go through every day in a normal work day is also full of ticks, but you never noticed, right? So I think either way, I would personally put them together. Sometimes people would say, well, I think there's no consensus there. Like some of them were really interested in it and wanted to know more, and some of them would have had 2 sessions, one for the theory of it and one for just the sampling. But I see they go well hand in hand.
That's good. That's interesting. What did you do to help prevent tick bites and mosquito bites to these citizen scientists that were going out into mosquito and tick areas?
Very good question. So of course, at the beginning of the workshop, we asked them to sign an informed consent form, just to make sure that they feel that they have received the information. They are aware that they are exposed to these bites when they're leading the sampling activities, but at the same level as they would be normally during the regular course of their day as outdoor workers, right? So if anything, I think they would be better prepared to these things. There were obviously, like I showed in the Turnkey the starting kit that they all received. They had like a full-on suit, Tyvek suit combination that they were asked to use. And obviously in the first 90 minutes of training, we talk about ticks, but there's a big accent, a big focus being given to the preventive measures, which is interesting because in the mosquito part, we joined both tick and mosquito prevention, which are fairly similar. Some of them are more specific to one or the other, but they do overlap over a lot of a lot of measures are overlapping, and so they were just giving a lot of. We spent a lot of time on preventive measures to make sure that they would not be excessively exposed to the bites. And obviously that we were always there also in support, even remotely, to make sure that everything was running smoothly and nobody was in danger. And yes, I think that's it.
Okay, good. Just a reminder to all participants, you can ask your questions by just typing them into the Q&A box at the bottom of the screen. We'd love to hear from you. Another question, I thought it was so interesting seeing all those traps that the ambassadors had built themselves. They'd really got creative using materials they had around the house. Do you have more to share about that process of asking people to build their own traps and how that went?
Very interesting also. I did not think people would be so creative or so willing to start doing DIY project, because originally we had thought of providing the professional traps, but then because of COVID and because also logistically speaking, we're using dry ice and these kind of things remotely got really quickly complicated. But in terms of trap conceptions, I mentioned we had a little budget for each and every one of them to buy whatever they needed, including the repellents, for instance, or the nets or whatever they needed to make sure that they would be protected, which in the first project it was already provided in the starting kit. But a lot of them did not even have to use that money because they used items and stuff that they had lying around around their house or at home, and then that's also the idea of the traps, right? We wanted to make it as easy as possible and not necessary, not some traps that would not require anything out of this world, like nothing too expensive or nothing that is hard to come around, or and it proved to work. Like people were creative, and then it was not brought to my attention that people were not able to build the things. And the pooter was, I guess, at least for me, it was the discovery, because it's the one that the ambassadors like the most, and I liked it also now because it's something it's lightweight, you can carry it with you, it's not super big, it's not bulky, it's super effective. The mosquitoes trapped, so it's not going anywhere, it's not damaged, it's easily to just put it in the freezer. And then so yeah, it covers a lot of the downsides of other trapping methods that are either bulky or stinky or complicated or not, or you get really smushy samples. Or so this one I liked a lot. It was a good discovery, and also kind of easy to build.
Yeah, it was very neat to see how many different types of mosquito traps there are. Got a question.
Sorry, I did not mention, but obviously different methods will trap different mosquito species. So in terms of public health, that's where the part where we're still analyzing now is that we do not know. It's going to be an interesting part of the project to see what type of species we're collecting, and are they species that are of concern in terms of public health, or are they just other less important species that are also found in Quebec but are not like potential vectors of diseases, and then see which trapping mechanism attracted which type of species, and then adapting it accordingly. That's going to be also interesting.
Yeah, we really look forward to seeing those results and learning from them. Got a question here from one of our attendees asking, what was the age group of the ambassadors? Was it younger people or a mix?
Also, very good question. I did not go into details about this. So in terms of ambassadors, it was mostly adults. I would say for the first tick one, it was I remember it was between 25 and 50 years old, I would say, for the ambassadors. And in terms of people that would train or give the information to, relay the information to, that was wider, especially for this one on the mosquitoes. We had a lot of teenagers and summer camps that relayed the information. So we had, I don't want to say 50-50, but like there was definitely a younger crowd in the outreach. But for the ambassadors, they were all 25 and older. We also did not mention this, but the ambassadors, we obviously recruited the ones that were interested and available, but also experimented outdoor workers that we know that would not put themselves at risk, and that would be able to, like, we obviously selected the ones that fitted the job description.
Yeah, that's clearly very important, is getting the right ambassadors into the role. Yeah, that's good. Well, I think that's all the questions we have coming in from the audience. So we'll wrap it there. Do you have any last words that you'd like to share?
Not really. Thank you for listening. Now on the screen, there's the different links I mentioned earlier, but they're going to be also in the follow-up email that anybody will receive. So in terms of publication about these projects or the webinars, I'll be also giving information tomorrow about the same topic. Yes.
Great. Yeah. So yeah, I'll share all of this information in the follow-up email that you'll all receive later today. I'll have all those links there for you. And just a reminder to please fill out the evaluation form that will open up in your web browser as soon as closing this webinar. It's really helpful for us to get that feedback from you. And thank you so much, Karl, for joining us today. It's a really fascinating presentation. It's so interesting to learn about your citizen science projects.
Oh, thank you.
Yeah. All right. Well, have a nice day, everyone. Enjoy.